comply, wearing masks, going to shops. And even like outside the shops, you'll see securities. They will ask you, sister, can you please sanitize? Where is your mask? And if you're not wearing a mask, you can't go inside. The only problem, people, they don't want to do social distancing. And if maybe you try to talk to them, say, oh, please guys, social distancing, the tone yakhona uvele uthi ithi ngiphume endabeni zabantu.
Different employers are taking precautionary measures. I mean, if you look at the SABC, we check our temperatures every morning when we arrive. We wear masks. There are sanitizers all over. And even if you go to different businesses like malls, going to the banks or retail stores, they also got sanitizers all over. They wear masks. So I think they are following government rules and regulations.
I don't think generally people, including companies and corporate spaces, are following the COVID protocols as they used to at the beginning of this virus. In recent times, you would still walk into the mall, for example, and proceed to the shops without being sanitized. And when you're inside, you still see people with a mask below their mouth, and life goes on as if nothing is bugging people out there. So I feel like people are COVID fatigue. They are tired of this thing. They want to go back to their normal lives. But at the same time, our enforcement as people is lacking. It looks like South Africans generally, they like being policed.
For me, because I only go to like 1 or 2 malls in my neighborhood, so I can reduce my movement. I find myself at similar shops all the time, so a similar mall, and so far they really are complying with the COVID-19 regulations. I've never really seen a decline or shops doing less or the malls doing less from the first time. It's always been very consistent. I think once in a while I feel over sanitized, especially when I go to the shops, because I'm like, you can go from this shop, the one next door, it's the same thing, the one next door, it's the same thing. When you get home, your hands are sticky from the sanitizing and the masks. So from my own experience and the places that I go to, I feel like they have been adhering to the rules.
Are companies, like many South Africans, experiencing COVID fatigue? Are employers still taking precautionary measures to prevent the spread of the virus? What is expected from businesses when it comes to precautions to prevent the spread of the virus? And what happens to companies that do not take these precautions to protect their employees and customers against the virus? Hello and welcome. I am your host, Dr. Musamtomene, and today on Vital Signs, we focus on corporate wellness during COVID-19, as well as panic attacks during this mental health month. Coming up on the program, we speak to corporate wellness expert who is the chief executive at Proactive Health, as well as to a psychiatrist who's the national public sector convener of the South African Society of Psychiatrists. Sama Buthelezi will update us on the latest South African COVID-19 numbers. And lastly, Dr. Marlon McKay will be back and he'll be giving you answers at all things when we speak about COVID-19. Remember that you can be part of the show by asking our guests some of the questions that you may have in your mind, or you could simply share your views on what we're talking about today. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts and opinions with us on social media using Twitter, and that is at SABC Vital Signs, as well as Facebook at SABC Vital Signs. That's where you can find us. The show continues right after the ad break as we speak to corporate wellness health expert Dr. Fundile Nyati about corporate wellness during COVID-19. Stay with us. Welcome back back. This is Vital Signs, and as a country, we're commemorating Corporate Wellness Month, and of course, COVID-19 pandemic has definitely created uncertainty over the economy, employment, finances, as well as relationships, physical and not forgetting mental health, leaving us with no sense of control over our lives as well as well-being. Now, if you've just joined us, we're talking about the role that corporates have in terms of ensuring that the environment is safe for employees as well as customers. We're joined by corporate wellness expert, that's Dr. Fundile Nyati, a health expert, as well as Chief Executive at Proactive Health. Welcome to Vital Signs, Doctor. How are you this morning?
Good morning, Doc. I'm good, and good morning to all of your viewers.
So let's talk about it. It is Corporate Wellness Month. What does that mean, and what does that mean specifically for people that are employed in some sort of formal setting?
What it means, Doc, is that, the sector of the population, or the segment of the population that is working, their employers, they have a duty to ensure that their employees are healthy, because we believe that healthy employees are productive employees, and productive employees will then help the businesses to actually grow. So it is actually in everybody's interest that the people in the business are actually healthy.
So what does corporate wellness entail? Does this mean that I have to disclose all the illnesses that I have to my employer so that they know that when I say that, I can't come to work today, they understand that I'm not at work because of reason A, B, C, D? Or is it more of a general type thing where your employer, once in a while brings in a team of nurses to come check your blood pressures and things such as that? What does it entail?
All right. So a typical corporate wellness program is actually an employer-funded program.
Okay.
It's a program that the employer funds over and above contributing to medical aids.
Okay.
This is supposed to be a program where things are done at the employer level, that is at the workplace, so that there's less need for people to go see doctors or be admitted in hospital because they've got a problem. So they are more on the proactive side of healthcare. And so it entails, what we call employee assistance programs, that is the counseling side of troubled employees.
Okay.
It entails occupational health and safety, that is employers have got a duty to provide a safe and healthy environment for employees and also other stakeholders who come to their premises.
Okay.
It also entails management of sick absence, within the organization, because there's also the problem of abuse of sick leave benefits by employees. But there's also a lot of people who are genuinely sick who, if they are assisted early, can actually be kept within the organization.
For sure.
It entails issues around managing disabilities from either injuries or illnesses that may otherwise lead to exit on ill health grounds. So those are the components of a wellness program.
So,
and obviously wellness days as well for general employees, and executive medical programs for the top executives who are obviously, huge investments within almost every organization.
for sure. So why should employees partake in these wellness days, for instance, or these programs that are offered by the employer?
Well, I think it is important for them. Remember, they are not paying for it, but it's important that they participate, because it's an investment that their employer is making on their health. And if they take advantage of these benefits of these programs, it may mean less use of their medical aid benefits, down the line.
Okay.
And obviously the components of a program, they include health promotion, being given information so that you can be able to make certain changes in your behavior and lifestyle so that your risk for illness is reduced. But also it includes people getting certain vaccines, hepatitis or whatever, depending on their risk, and they're not paying for that. But it also, includes health screening, being able to identify problems before they have become serious, which is what we call checking blood pressure, sugar, cholesterol, body weight, and other things that one can screen for.
So with the pandemic that we currently have, why is it, or rather, what is the role of corporate and government within the space? I mean, you're dealing with people not going into work physically, but these are people that may still have the same problems that they would have presented with without a pandemic existing. So how do we navigate the space?
Well, I think what we need to understand that even before the pandemic, there were already, issues. South Africa, the people who are working are actually a representation of the society they come from. And South Africa is not a very healthy country. Majority of people who actually die every year are dying from lifestyle diseases, hypertension, diabetes, heart attacks, and strokes, So this is the situation before. Also, before, at least 1 in every 4 working people in South Africa had a problem of mental illness. Others they have disclosed, others have not disclosed. So COVID-19 has come in and has actually worsened the problem, especially on the mental health side, because now we're talking something about 1 in 3 who are likely to have, mental health problems, but also on the lifestyle side, lifestyle illnesses, management of those conditions has been a bit of a challenge as people are worried about going to pharmacies to see doctors or even hospitals because they are worrying about catching, this, and also the stress. The health anxiety about the whole pandemic is worsening the control of some of those conditions that were actually under control before.
All right, so we'll continue this conversation after the ad break, but very quickly before we go, I just want to find out about what employers are supposed to do in this pandemic world that we find ourselves in. If you are, we're not in level 4, we are at a point where, let's say we're level 1 or 2 or whatever it might be, and employees are allowed to come back to the office, what should employers be doing to protect their employees?
Well, employers have to be part of the solution to the problem. The cost of them doing business during this pandemic is that, they need to put measures in place in terms of the regulations. They must have, a COVID committee that drives compliance to the regulations, and that committee must have people, who make sure that there is awareness creation within the company about the do's and the don'ts. People are tested every day when they come in. They fill in a questionnaire that is doing a screening to check their risk, and those who are found to have high temperatures or possible contact, they are sent, for assistance, and there is support for those who are actually COVID-19 positive, but also all the visitors to their premises are also checked. So if they don't do those things, then they can actually be found to be non-compliant, and that may actually lead to them, being, taken to task by the relevant department.
Okay, Doc, we're not going anywhere. You're staying exactly where you are because we're going to continue this conversation. Quite interesting. I mean, a lot of stories that you hear where employees feel like employers are not protecting them, specifically during this time where you find yourself being forced to go to work, getting to a workplace where there aren't any precautionary measures and things such as that. Quite interesting. And of course, we'll get into who is responsible for making sure and ensuring that the workplace is a safe place. We'll continue the discussion with Dr. Fundile Nyati, health expert as well as chief executive of Proactive Health. You can also share your thoughts with us on social media. On Twitter, it's at SABC Vital Signs, or Facebook, SABC Vital Signs. And that's where you put your opinion, and that's where we'll find it. Stay with us. We'll see you after this. Welcome back. Welcome to it. This is Vital Signs, and we continue our discussion with Dr. Fundile Nyati, health expert and chief executive of Proactive Health. And we continue this conversation. Dr. Nyati, back to it. Before the ad break, I raised an important point, and this was one where if employees feel that the employer isn't doing enough to protect them during a pandemic or isn't doing enough to look after their mental health and things such as that, what should they do? What do employees have in terms of recourse?
All right. If you remember, I mentioned then that, all employers have got a duty to comply to the Occupational Health and Safety Act, 85 of 1993. Now, there are health and safety committees that are supposed to be in place in every work site. And so the members of this COVID committee are actually, most of them, members of that safety and health and safety committee.
Okay.
So they have a right to actually escalate their unhappiness to the accounting officer, that is the CEO of that particular, company, or HOD if it's a government department. And if they are not being listened to and they feel that they are at risk, they can actually take that with the Department of Labor, because there's supposed to be a unit that ensures compliance at the Department of Labor. So that is the recourse that is there for employees who feel that their employers are not doing what's expected to do.
In your experience, does the department really do the monitoring? I mean, if Musa, who's Mr. Anonymous at his workplace, feels like there's no sanitizer, everyone is not wearing a mask at work, there's no social distancing, and I write this complaint to the Department of Labor to say that our workplace isn't safe, do they actually come out? Is the monitoring done?
Well, in an ideal world, you would expect them to actually, respond. But one of the weaknesses, general of compliance on the area of health and safety is that the unit within Department of Labor that is supposed to ensure compliance, the investigators that are supposed to go and investigate such complaints, there's actual serious underfunding. As a result, some employers are aware that there is that weakness in the system, and so some do get away with it. But obviously, if they find that you have deliberately not complied, that can actually mean your business can be closed for quite a period. So it's a very, very big risk if one is an employer and they decide not to comply, because it could hit you very hard, in terms of business operations.
So in terms of your business personally and the experience that you've had within the sector, what services have you given and offered, and what should people do with respect to getting mental health assistance during this time?
All right. So since the pandemic started on the 5th of March here in South Africa, what we have seen is that although most programs were underutilized before because employees, they don't really think they need them, there's been an increase in the uptake in the use of various aspects of the programs, especially, the employee assistance side, that is the counseling side for troubled employees, and also the occupational health and safety side. So what we've been doing as an organization supporting employers has been, creating awareness about, the COVID-19 pandemic, teaching people about the basics, that is at the early part of the pandemic. So we're doing a lot of that, and also helping employers to set up programs, and some of them, they've gone into short 6 months, 12 month kind of programs. We've helped them to set up, but also training their COVID committee members and the health and safety committees. So those are the kind of things that have been happening. But the biggest need at this moment is around matters of mental health and well-being, because a lot of employees are just not okay, whether they are at home, working from home, or in the workplaces. The levels of mental health, anxiety, depression, those who were previously well controlled, that have now become, poorly controlled. So the mental health aspect of the total health is the biggest need at this moment.
Okay, and lastly, Dr. Nyati, the last wrap-up is we're in level 4. People have been told to work from home once again, those that do work from home. How can they improve their mental awareness, their mental health in this time period?
Well, there's a couple of things that people can do. I think one of the biggest issues, is that there's a lot of anxiety in general because of the uncertainty, about this pandemic. Also, one of the things that people need to do is to have times where they mute themselves, meaning they cut out news, because the news that we are seeing daily, social media or even mainstream, sometimes can be too much. So people must learn to consciously cut down the news. Number two, people must focus on things that they have control over, and not focus on things that they don't have control over. That is scope of control. Number three, people must try and get relevant information from credible sources, because there's a lot of misinformation and disinformation that makes people even more, anxious. Number four, people, when they start to feel symptoms, they must go and consult, professionals, and stop this thing of hearing from people who are, using Dr. Google, who are not necessarily trained, in healthcare. And number five, we need to make sure that we support each other. This is the time when we need Ubuntu. So even though people are physically distanced, but we are not necessarily socially distanced, we can use a lot of technologies to keep check of other people.
All right. Look, amazing to hear, and I'm very glad that corporate wellness is taking the step that it is, that it's coming up to the place we expected, because we know that corporate has really been identified as a really toxic environment, not only from just being overworked and being paid very little money, but also from the perspective where, a lot of people feel like their mental health isn't taken seriously, that their physical health hasn't been taken seriously. And we'd like to thank you this morning. Yeah.
Thank you.
All right, Doc. That was Dr. Fundile Nyati, of course, a corporate wellness expert at the company and, of course, Chief Executive at Proactive Health. After the break, we speak to Kagiso Maruganye, a psychiatrist, as well as the National Public Sector Convener of the South African Society of Psychiatrists. You can also share your thoughts with us on social media. It's at SABC Vital Signs, and, of course, our Facebook page with the same name. Do not move a muscle. We'll see you after this. As if being alone at home in isolation battling COVID-19 isn't bad enough, hearing that someone at your workplace contracted COVID-19 or died from COVID-related illnesses can cause panic, anxiety, as well as stress. But what happens when these are left untreated? Samabuteleza spoke to people who are braving the virus and have to go out and find out from them. What happens when they hear about colleagues who have contracted the virus, infected their families, or those who have died from COVID-related complications? Let's listen to what they said.
The moment you hear that somebody has tested positive or has died due to COVID, most of my colleagues have been saying, or some of my colleagues have been saying, the anxiety just rocks up. I stay with a 1-year-old, 6 months child, and my wife. So the first thing that I do when I get home, I just take off my clothes and then I just steam, and then I take my concoction, which is ginger, lemon, and garlic water that I drink almost every day. So I just pump up and take more of that.
We are already paranoid with the whole pandemic and COVID-19, and we don't know what to do. So we are always in a state of panic. So when you hear about someone testing positive in your office or in your environment, then your anxiety just flares up and you don't know what to do. For me, I'm a parent, so I live with a 3-year-old and my mother. So my anxiety just shoots up the roof. Now, I don't know if I have to test or test the whole family. It's a whole mess. It's just painful for us to live with.
So when I hear that someone from the office tested positive, it causes me to panic and to worry that what's going to happen to me. Am I also infected? Is my immune ready for this? So it's really a bit scary. So I need to take the necessary precaution, isolate myself, and maybe get tested.
So the first thing that hits me when I found out that a colleague has been infected with COVID-19, obviously it's fear, especially if I know that I've been in contact with the person. Secondly, obviously I'll feel sad, I'll feel sorrow, I'll feel sorry for my colleague. I'll make a call first thing, check on the person. Second thing, if I've been in contact with the person, obviously, go to the doctor, check myself in, just check if my temperature is fine, everything, because they say you shouldn't just go to the doctor without any symptoms. But obviously because of fear, I would want to, consult with the doctor. Then secondly, I'll just check myself, monitor myself, then just to see if I have symptoms. But I think the best thing to do is to just stay away from work for a few days to monitor yourself if you know that you've been in contact with the person.
Interesting views there about what all of this means. And I think we're in a very special month, and we're going to get into that discussion in a little bit. If you've ever felt a little bit more anxious lately, you know, found yourself having or thinking that you may be having a panic attack, or even witnessed someone having a panic attack, well, listen up, because we've got Dr. Kagiso Maruganye, a psychiatrist who's joining us, who's also the National Public Sector Convener of the South African Society of Psychiatrists. And he's here to answer all those questions that you may have at home, as well as provide us some tips and tools on how we can really deal with panic as well as anxiety. Welcome to the show, and thank you for being here. Now, we're in a very special month where we find ourselves, you know, looking at the month where we put mental health and mental wellness on a pedestal. I mean, I feel like we should have it as a year-round thing, but, you know, let's commemorate what we have. And this month, we are specially focusing on panic awareness. Doctor, can you tell us what panic attacks and anxiety are?
Yes, thank you, Doc, and thank you for inviting me onto the program. Basically, a panic attack is an intense feeling of fear that overcomes us when there's no cue or there's nothing that's sort of provoking the fear. And then you can experience this for about 5 to 20 minutes. And it's just episodic, and then it goes away. But the key factor of it is that it's intense. You feel scared, you're fearful, but there's no cure, there's no cue, or there's nothing when you look around you that could have caused that panic attack to have occurred.
So I'd like to break that down a little bit more. So you're saying that a panic attack happens without a cause. You know, you suddenly feel as if, you know, you're scared or you're fearful. What happens if, for instance, there is something that gives me panic and I end up having the symptoms, which we'll get into in a little bit, of a panic attack? So a rat runs past me in the street, and obviously that makes me fearful. But now I find myself having the symptoms. What's the difference then?
Yeah, that could be a specific phobia. So if you're afraid of rats, or you're afraid of heights, or you're afraid of water, and every time you're around those sort of circumstances or those objects or elements, then you start being fearful. Then it's a specific phobia that you have for that. Like for now, people may have a fear for needles, for example. So when they get vaccinated, they may start becoming fearful. But you find that with a panic attack, it can occur in those situations, but oftentimes it occurs spontaneously, and there's nothing around you that should cause you fear, and then you should start getting worried. I mean, we're all allowed to have 1 or 2 panic attacks in our lifetime. That is fine. But when it occurs frequently, for example, once or twice a week, then we should start getting worried.
So what are some of the symptoms or the things people need to look out for from themselves if they think they're having a panic attack?
Yeah, there are a lot of symptoms, and for different people, it can occur in different ways. The common ones would be just basically you're fearing loss of control. Everything was organized in your life. You were driving, you were in a meeting, you were concentrating, and all of a sudden you feel like you're losing control. You feel like you're about to die. You start having palpitations, which is your heart sort of going fast. You start having difficulty breathing. You're trembling, so your hands are shaking. Some people even start sweating. But another common one that we see, we also see people feeling dizzy or lightheadedness, and some people can actually end up fainting. Abdominal cramps as well can happen, and nausea as well, and hot flashes. So all of these different symptoms can indicate that you may be having a panic attack.
So from someone experiencing these symptoms, you know, just once in a while, to someone being termed as someone that has panic attacks, what's the difference there?
Yes, like I was saying earlier, I mean, if you have them once in a while, it's fine. I mean, it's a normal process. It's part of what we call fight. Basically, if you're basically faced with a lion or something scary, biologically, there's a mechanism in your body that tells you that you need to prepare yourself to either challenge whatever threat you're faced with, or you run away. So in that case, you start to sort of your heart is pounding and you're breathing fast. But in this case, it just happens spontaneously without that happening. And like I said, it occurs frequently. But the other problem is that after it has occurred once, now you start fearing that you're going to have another one. And that's when you start getting into panic disorder.
Okay, so let's lightly touch on panic disorder. What's the difference between one panic attack and panic disorder?
Yes, so panic disorder is basically you're going through a process where you have frequent panic attacks, But then for a month after that, you start worrying about that you're going to have another one. You start feeling that, you have lost control of your life, and that feeling can last for about a month. Or you start avoiding certain situations. So you reckon that the last time I had a panic attack, I was driving, or the last time I had a panic attack, I was in the mall. So you find that for the next month or so, you avoid those situations. Then it is what we call a panic disorder, after you've excluded excessive substance use or medical conditions.
Okay, so we've got a question from a viewer at home. I think it's Portia on the line. Portia, you have a question for the doctor. What might that be? Hello, Portia.
Okay, I felt this panic attacks. I think a day after I was diagnosed with the COVID.
Okay.
But then yesterday they were. I think I was having from in there about 6 o'clock until about 8 o'clock. Yeah. So I'm not sure if it was related to COVID or what.
Okay, so are you saying you had a panic attack from 6 to 8 yesterday?
Yeah, like they stop, come again, stop, come again.
All right, so Doc, you heard the question. She was diagnosed with COVID and has since then been having these long, prolonged, sessions where she's finding herself feeling like she's having a panic attack. What do you think is going on?
Yeah, it's a bit of a difficult one. I mean, as we know that, COVID-19 affects the respiratory system quite often, but also affects the person's neurological system as well. So you may find that some of these symptoms can either be associated with what's happening in the person's respiratory system or the neurological system. So it's a bit difficult sometimes to tell whether this is a panic attack from a psychological point of view, or whether it's related to the medical condition. I would obviously suggest them to have a word with their doctor, and their doctor obviously knows them quite well and will be able to see whether these are still the tail end of COVID-19 condition. Obviously, when you go to the doctor, then we examine you physically. We check your chest, we check your sets, and if you find that these are normal, we also take your bloods. Then we have to start thinking this could be a panic attack. And a panic attack could be basically because you've been through COVID, which is a life-threatening condition. It's quite stressful, it's quite traumatic. You probably fear that you're going to be dying. So you're allowed to have these panic attacks. And if they become too frequent and affect your work and your social life, then maybe you should see a psychiatrist or a psychologist so we can help you.
Okay, so I think it wouldn't be fair for us to end this discussion without talking management. How does someone at home, for instance, who's been diagnosed with COVID, so is unable to leave the house to go get this treatment and these sort of management tools that we've discussed, how do they deal with an infrequent panic attack? How do we manage panic attacks?
Yeah, thanks, Doc. So there are three parts. The first part is basically what you can do for yourself at home. So some of the things you can do is exercise, basically, that can calm you down. That's one thing. You can try to have sufficient sleep as well, so you don't feel tired in the morning. And also, try to identify to yourself that, everybody's having COVID, this way in the pandemic. Obviously, everybody's stressed, and this may have affected as well. And I'm hoping that in due course, then I will be fine. And obviously, don't drink too much coffee. So these are the things that you can do at home. The second part is that you can see a psychologist, and the psychologist will apply what they call CBT. Basically, what we're trying to do is that your worry is that you're gonna die, and then this experience that you're having is dangerous. So what we're trying to do is that we're trying to put you through a series of exercises to show you that no, this is not dangerous and you're not gonna die. And we try to sort of numb the feeling, so eventually you don't fear the panic attack, and then the attacks will diminish. And we also help you approach some of those situations that you're avoiding. And lastly, we're talking about medication. And the medication that we normally use for depression, that's a medication that we'll probably use for the panic attack as well.
Okay, thank you so much, Dr. Marohanyo, for sharing your views from a psychiatry point of view about what panic attacks are, panic disorders, and what people generally should be doing to look after themselves during these times. I think we're in such heavy times where, you know, people are dealing with physical illnesses, dealing with mental illnesses, dealing with anxieties and stresses, that all this stuff sort of piles on top of each other, and we find ourselves in positions where, you know, you find yourself having a panic attack. So thank you for sharing all those views with us this morning. Of course, that was Dr. Kagiso Maruganye, psychiatrist at the National Public Sector Convener, as well as, you know, giving his views on what we need to look out for. After the break, Zama Buthelezi will take us through the latest South African COVID-19 numbers, and we speak to Dr. Marlon McKay, who will answer questions about COVID-19 symptoms raised by some of our viewers on social media. Stay with us.
A very good morning to Vital Signs viewers. We are seeing a downward trajectory in the numbers of new COVID-19 infections in most provinces, but more hospital admissions. According to the National Institute for Communicable Diseases, testing rates have decreased in the past 2 weeks. And while this may be reflective of a decreased need for testing due to decreased infections, access to testing has been limited in certain areas due to the social unrest. Trends in the coming weeks will be important in confirming whether the peak of the wave has indeed been reached or not. For now, though, let's take a look at the national COVID-19 statistics. Since the first case of COVID-19 was reported in South Africa last year, over 14 million tests have been processed in South Africa, over 2.3 million positive cases recorded, over 2.1 million people have recovered, but sadly, more than 68,000 people have died from COVID-related illnesses, and we're sending our sincere condolences to their family. Great news, more than 6 million people have been vaccinated in the country. So what's happening in the provinces? The 7-day moving average daily numbers of cases has decreased. Gauteng remains the epicenter of the third wave of this pandemic. The number of Gauteng vaccination sites has been increased, and for those who are not able to go and vaccinate during the week can do it over the weekends. Eligible South Africans are being urged to register and get their jabs. For now, though, let's take a look at the infection numbers recorded in these big provinces. To date, over 830,000 positive cases have been recorded in Gauteng. Over 380,000 positive cases have been recorded in KwaZulu-Natal. Over 370 positive cases have been recorded in the Western Cape. Over 220,000 positive cases have been recorded in the Eastern Cape. The remaining provinces are also seeing a decline in numbers of new infections. While this is good news, it doesn't mean that people should become complacent, as COVID is still around. We have seen what has happened in the past where numbers just increase significantly. And mind you, the Delta variant, which is more transmissible, is still around us. For now, though, let's take a look at the numbers recorded in these provinces. Over 120,000 positive cases have been recorded in the Free State. Over 121 positive cases have been recorded in the Northwest. Over 117,000 positive cases have been recorded in Mpumalanga. Over 105,000 positive cases have been recorded in Limpopo. Over 64,000 positive cases have been recorded in the Northern Cape. Vaccine registration is still open for those ages 35 and over. The response, according to reports, has been fantastic, with more than 1 million registrations observed on the first day of registration. So you are all urged to register and go out there in numbers to vaccinate to lower COVID severity and hospitalizations. So to prevent the spread of the virus, we are all still urged not to become complacent, as the virus is still around. So let's continue to take precautionary measures. And as always, these include regularly washing our hands with soap and water, as the virus stays active on surfaces that we touch. Sanitize using sanitizers containing 70% alcohol content. We must all continue to wear a cloth mask that covers both our nose and mouth in public. We must also continue to practice social distancing and ensure proper ventilation indoors. Most of all, avoid mass gatherings. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a free number, 0800 029 999, and alert them to your symptoms. Remember to protect yourself, to protect others. Thank you so much, and back to you, Musa.
Thanks so much, Zama. Those numbers, how do you feel about them? Looking under 10K, but it doesn't feel like we're out of this third wave, not at all.
Not at all, Musa. Like I said, I'm yet to see in the next weeks what's going to happen. But I've seen, especially on social media, so many people saying, rest in peace, rest in peace. People are dying and we need to take extra care. And by now, it's people we know, family members, friends, colleagues.
For sure.
It's quite
For sure.
sad.
Yeah, look, it's very difficult to believe those numbers being under 10K when you have 600 deaths on the same day. Quite interesting times that we live in, and hopefully people will start going out to retest so we can get a real reflection of what the numbers actually look like. It's time for us to talk to Dr. McKay, who is here to talk about all things that have been frustrating a lot of South Africans. People are sitting at home, have tested COVID positive, and really don't know what to do. They don't know where to take their frustrations, don't know what to do with their symptoms. Am I experiencing a new version of symptoms with this new Delta variant? What do I do? So, Dr. McKay, let's talk about it. Vaccine, vaccine, vaccine. That's been the talk of the past couple of weeks, where people are going out very excited, getting their jab. But we're also getting, you know, these stories that are coming out once in a while of people getting a jab and then something unfortunate happening. One of the messages I think we'd received is a message of someone saying that their neighbor went to go get a vaccine, came back on the same day, slept and never woke up again. So what do we do, and what happens when we hear stories such as these?
Yeah, I think we must be careful of just spreading stories like that and try and get the real story behind the story. Firstly, the main story is that the vaccines generally are safe and effective, and there's always a reasonable, logical explanations and scientific explanation behind each one. So before the vaccine gets labeled as so-called dangerous or it kills somebody, there's usually something, and usually something like the person was sick before, the person has a heart issue, and most of the time, Doc, we know that it is actually unrelated to the actual vaccine.
All right, so we've got a call. Anonymous is calling in, and they have a question for you with regards to vaccines. Hello, Anonymous.
Hello, yes, thank you very much. You're doing a good job.
Thank you. Do you have a question for Dr. McKay?
We've got a serious problem. This thing is so serious that people don't using mask, and then when he's sitting and have parties, he don't using any mask.
Okay.
So I like to know, what is the serious problem about this COVID-19? And another one, I know about a lot of people who's getting these injections who passed away afterwards. And another thing is, when you got penicillin, how you can use that stuff if you get penicillin. So I just explained to you now, I'm 60 years old, over 60.
Okay.
I will never, ever use that thing. I don't instigate anyone.
Yeah.
I just explain. And your people must doing with the Minister from Police. Tell the Minister from Police he must do his job, because people driving around at 12:30 in the morning in Malabongwe.
Thank you, Mr. Anonymous. You've got a variety of questions that you've asked us and made some statements, but I think Dr. McKay will answer some of them. I think his one question was the issue of vaccines, and people obviously you're not doing well after having taken it, and that's the story there. The other, I think, lives around penicillin. I think his argument might be one where if you've got an allergy or penicillin allergies and things such as that, can you still take the vaccine, even though he has stated that he hasn't taken one as yet?
Yeah, so the second one first, there is absolutely no reason. There's no penicillin in the vaccine. It's got absolutely nothing to do with penicillin. So you are safe to have the vaccine if you do have a penicillin allergy. And again, coming back to this issue of something happening to people, we say in medicine, association does not necessarily mean causation or causality. Just because there was an associated death around the issue of vaccine doesn't mean that the vaccine necessarily caused it. They could have been sick. They could have had other health issues. And also just remember, you are only regarded as fully vaccinated, especially with the Pfizer vaccine, 56 days after the first dose. So you have the first dose, 42 days later, second dose, 2 weeks after that, then you are regarded as fully protected. So you can still get COVID after the vaccine. It's not the vaccine's fault. The vaccine hasn't reached efficacy levels yet.
So an important thing, and I think that you've raised there, is the issue of once people get a vaccine, a lot of them think it's a good time, it's Christmas now, let's have a good time, no more masks, no more sanitizing and things such as that. And the one thing that we keep saying time and time again is the issue that you can still get a COVID infection even if you've gotten the vaccine. What the vaccine does is that it makes your illness less severe, and that's the important thing to note here. Okay, another question for you, Dr. McKay, one from Nusihla saying, what about us long haulers? Can we take the vaccine even though we have symptoms almost all the time?
Yes, absolutely. So the policy with regard to having had COVID more recently, if you've had a mild infection, you haven't needed oxygen, no hospitalization, then we advise you to wait about 30 days before taking the vaccine. If you've had more severe, where you've needed oxygen or had to be hospitalized, rather wait at least 3 months, 90 days. Bearing in mind that straight after the infection, you have natural immunity. You have the antibodies from the recent COVID. So there's no actual rush to get the vaccine because you are still fairly protected. And so having long-haul symptoms or long COVID is not a problem with getting the vaccine.
Okay, another question about the vaccine and pregnancy. Should pregnant women go out and get the vaccine?
Yeah, so there's a lot of studies being done on this, and I think what is coming out from the data is if you're beyond 14 weeks, it's okay. And bearing in mind the other thing, it is the benefit of getting the vaccine and not getting COVID is much higher than the risk of getting COVID to you and your unborn baby. So it's the data will probably show very clearly soon that it is safe to have the vaccine for you and the baby.
All right. Thank you so much, Dr. McKay, for joining us and answering those vaccine-related questions. I hope all those that are at home wondering, thinking, can I take the vaccine? Will it leave me dead? And things such as that are getting their questions answered. It's always important to ask these questions, but also remember that misinformation and disinformation and just fake news in general does exist. So take everything that you hear from people that aren't authorized sources of information with a pinch of salt. Thank you so much for all the guests that have decided to join us today and participate by giving all the viewers at home all the information that they need. And this is this episode of Vital Signs. Remember that you need to stay at home, continue social distancing, and doing all the things that you need to do, even though you've been vaccinated. In closing, we'll play out with the song commissioned by the South African Medical Association, SAMA, and artist Loy Ele, thanking healthcare workers for their hard work and dedication during the COVID pandemic. I'm Dr. Musaweko Simtombeni.